Alright, guys. So let's go through the questions. I know there have been a lot of questions. No sound. No sound. Let me see. Is it better? Here we go. Thank you, guys. Thank you. So we're just okay. Here we go. Yeah. There's somebody muted me. Okay. Thank you, guys. Sorry. All right, we're all good now. So Illumin is actually what we call a JAK inhibitor. So there are many different types of hair loss. There's androgenic alopecia, which is male or female pattern, and there's also other kind of genetic autoimmune hair loss. So alopecia areata is an autoimmune condition where the body attacks the hair follicles and creates these round patches of hair loss. So I actually have alopecia areata personally. I have it. Dr. Sean has it. So it's an autoimmune condition. So Illumid is actually intended for autoimmune conditions of hair loss, which is a JAK inhibitor, and it's a very expensive drug to get. So it's very difficult. But generally for male or female pattern hair loss, Illumid will not work. So it's no option, unfortunately. So you really have to see your doctor, and it really has to go through insurance because it is super expensive. What's topically used in minoxidil, same result with this, none. I don't exactly understand what that means. So Edie, can you just clarify exactly what you're talking about? We'll come back to it.
Oh, that same person also asked a question, maybe that's related. He was saying that he was getting scalp is irritated, not dandruff, but some crusting. Maybe he was referring to like the minoxidil, thinking that caused it.
So minoxidil could cause sometimes the scalp irritation. That is possible. So if both over counter and along with the prescription strength. So if you're getting irritated from the prescription strength minoxidil happy head, then my recommendation would be to reach up back to us, and we could lower the concentration of the minoxidil, and also something we could take even the retin-A away, so that could cause less irritation. So please reach back to us at Help a Happy Head, and we'll be more than happy to fix this situation for you. Why are the higher concentration of finasteride minoxidil better than the standard over the counter doses? What's the advantage of disadvantage of the higher doses? So typically, patients that when they go on higher doses, they just end up doing better. So we know that when patients go from 2% to 5%, the 5% minoxidil does better than 2%. We currently have the 8% minoxidil in our concentration in our formula, and patients typically from our clinical experience do better on the 8% than they do on the 5% over the counter. Finasteride over the counter does not exist, but it's always prescription, and we have the higher dose of 0.3% right now. And most patients are very happy with the results. And also the benefit of having topical finasteride is that traditionally oral finasteride causes sexual side effects. Topical has a lower risk of sexual side effects associated with it. What are the advantages and disadvantages of having the retinoic acid along with the hydrocortisone added to our formulas? So there are clinical studies that show that retinoic acid along with minoxidil makes the minoxidil penetrate better. So it just increases the efficacy of the minoxidil. The hydrocortisone is added to our formula because minoxidil could be a little bit irritating. That's why the hydrocortisone is there. Now some people don't want any steroid at all in the formula, please email us and we could definitely get rid of that for you. We'll just take it out. Remember, Happy is a customizable formula, so we could adjust the formula for you as you wish. I was using the topical finasteride and minoxidil combo and began to experience blurry vision and brain fog. I had a similar experience when I used oral finasteride back in 22. I got off the medication and tried the topical because I thought they may have less side effects. What do you recommend? So look, so yes, brain fog is actually, it could happen. It's rare, but it could happen. So it could happen with both oral and topical. You have to realize that although the topical has a low risk of side effects, people could still have side effects. I mean, is that a lower, is again lower risk, but people could still have it. So yes, you did get a brain fog. So here's my recommendation. One, we could lower the concentration of finasteride, see if that happens with the lower concentration or not. Two, we are coming out with a liposomal formula, and the liposomal formula supposedly does not really penetrate the bloodstream or very minimal penetration, so that may have a low risk of brain fog. So that's my recommendation. The blurry vision is most likely come from the minoxidil, so I'll probably lower the minoxidil concentration as well. So those are my recommendations, just lowering the dose of both the finasteride and minoxidil, see if that happens or not. And also, you don't have to use the product every day, probably just using it 2 or 3 times a week, see if that happens. So, been using the original topical solution with finasteride for about 4.5 months, seeing some results, but curious if switching to the new topical dutasteride will be worth trying. Yes, so dutasteride technically should work better than the finasteride, so if you're seeing some results with finasteride, you could probably see better results with dutasteride. So reach back to the customer service and they'll be more than happy to switch you to dutasteride. I'm very bald on top and understand what the results vary. I would like to understand finasteride versus dutasteride and which one I should potentially use. So here's the thing: if you're very bald, honestly, I don't think there's anything that's going to help you. Just telling the truth. But you could definitely try either finasteride or dutasteride. Dutasteride could potentially work better because dutasteride inhibits 2 enzymes, what's called 5-alpha reductase 1 and 5-beta reductase 2. So as opposed to finasteride, is only hitting one of the enzymes. So I would just jump directly to the dutasteride. I would like to discuss the excessive itching in my arms and legs after using Happy Head, which I quit after using it. What is the cause of the itching? So that's a very good question. So usually people basically itch on the scalp, not necessarily on the arms and legs, but I guess you could be very sensitive, and the product gets absorbed systematically, and you're just having a reaction to it. So I would not use it. I would not use the product with minoxidil in it. You could reorder the product and just have finasteride but no minoxidil and see if you still get the same itching on the arms and legs. But you are allergic to a component of the product. And it could certainly also be the finasteride. So honestly, it's hard to say which one it is. Probably it's better not to use the product at all. Thank you for letting us know. Also, my student doesn't include finasteride since my wife is pregnant. Would I be able to take oral finasteride? Yes. So if your wife is pregnant, we do not dispense topical finasteride, but you could certainly use the oral finasteride or the super capsule. Please reach out to the help desk and they'll be more than happy to order that for you. Since finasteride is a DHT blocker, does this mean that it blocks the testosterone from getting covered with DHT? So there's more testosterone in your system. How is it different from minoxidil mechanism of action? Great question. So finasteride, you're right, is a DHT blocker, preventing basically the formation of DHT. And we know that it's DHT basically that causing the miniaturization of the hair follicles. Minoxidil actually works in many different ways, but traditionally, the way it's been thought that it works is that it's a vasodilator, so it's increasing blood flow to the scalp, and by doing so, it washes away the carrion DHT that's in your scalp and brings more nutrients to hair follicles. So that's really, in a nutshell, how minoxidil works. And the reason why we created super capsule is because we wanted to target the many different ways, many different causes of hair loss. So, and this is why we put the two together in both the topical formula and the super capsule. Spironolactone mechanism of action. Why does it work so well for women? So I'm actually the #1 writer of spironolactone in LA, oral spironolactone. So spironolactone is a testosterone blocker. Different than finasteride. Finasteride is a DHT blocker, which means it's preventing the conversion of testosterone to DHT. Spironolactone blocks the binding of testosterone to the testosterone receptor. And that's why it works well in females. Typically in the US we don't give spironolactone to males because of potential breast enlargement. But if you're a female and you're on spironolactone and if it's not working, probably you could get better results by switching over to oral minoxidil. If you've been on topical finasteride, then topical dutasteride, and want to switch to oral, should they start with the oral finasteride super capsule or go straight to the dutasteride super capsule? I mean, that's a good question. I mean, currently, if you are on the topical dutasteride as we speak, I mean, you could do either one. I would probably just do the oral dutasteride. Actually keep using the topical and add the oral, because if you do that, you're going to see better results. Patients that do both topical and oral end up with better improvement. The only thing you have to realize about oral dutasteride is that it has a much longer half-life than oral finasteride. In other words, what that means is that oral finasteride, typically if you take one pill, the medication will leave your system in about a day, about a good amount of it, about almost 80 to 90%. The oral dutasteride half-life is almost 5 weeks, which means for that medication to basically to go down to 50% from one tablet, it almost will take 5 weeks to leave your system. Some patients say, oh, that's great, that means my hair is going to do better, but the problem is that if you end up with side effects under oral dutasteride, you probably may potentially have a longer term side effect. But overall, studies have shown that patients do very well on oral dutasteride compared to oral finasteride, and that it works better for hair loss. So if you do want to pick one ingredient that's probably better, it's probably the oral dutasteride. Would any of your formulas work well for a 62-year-old female who has diabetes? So none of these drugs typically interfere with diabetes. So you could actually go on the super capsule, which is a combination of oral minoxidil, oral finasteride, and vitamin D, and you should do well. Or you could go on the topical formula, the finasteride, minoxidil, and retinoic acid. That will also do well for you as well. Remember, you cannot do finasteride topical oral for females less than 50 years of age. 4 months, looking well. Grass is growing. I love it. Do I stick with finasteride minoxidil or should I try dutasteride minoxidil? Honestly, or should I rotate every month? Here's my idea. I think the reason why traditionally in the US we always start with finasteride is because that was like the go-to one. It works pretty well for most people. So if you're seeing good results with the finasteride, I would stick with it. I will only switch to dutasteride if you start plateauing on it. That's my recommendation, but I'm glad you're doing better. If I start using the super capsule, is there any benefit to using the topical happy aid with it once a night? Yes, there is. So we have seen from our own clinical experience that patients that are on oral and topical end up with better results. Now, the only caveat is that just don't start both at the same time. So you probably want to start topical first, and after a couple of weeks add the oral, or you could start the oral first and then add the topical. Just don't do it simultaneously. But if you combine both together, typically patients do see better results. How to deal with severe dandruff and some hair thinning in the front of the scalp? What spray would you recommend for my situation? So the question is severe dandruff coming from that using topical happy aid, or you just have it on your own? It sounds like you just have severe dandruff. So if you do have severe dandruff, the dandruff by itself is causing damage to your hair. So you need to get that under control. There's a shampoo called ketoconazole that I think we do have at Happy Head. And there's also a solution called clobetasol. Eric, are we dispensing clobetasol at all in our... No, not yet. So we are coming out with our severe dandruff formula. So But I guess for right now, you could get it from your own doctor. It's called Clobidez as a topical steroid solution that you could apply directly on your scalp, and that will reduce some of the inflammation. But if you do want to get unhappy, so you have two ways. One, you could just go on the oral super capsule, easy. Or two, you could try the topical, but you have to realize the topical has minoxidil in it and also is alcohol based, so it could be more irritating. So one my recommendation would be to do the lower dosage of topical minoxidil, 6%, with no retinoic acid, or you could also ask for the aqueous based formula, which is a water based formula, which is less irritating. Or you could just start with a super capsule and basically you don't have to deal with the irritation at all. The crown of the head is now covered. Can I use it on the front of my scalp? Do I use half on the crown and half on the front? So if the crown of the head is covered, that means you're getting good response. So what my recommendation would be to still continue to do half on the crown and half in the front now. Will I see Will I see some tiny hairs after 1.5 months? No, it's too early. Typically, it takes 3 to 4 to 6 months. I would expect to see some fine hair, but see nothing but skin. Well, first of all, you have to realize that the results varies in everyone. But again, it's just too early. Hair cycles take some time before basically the hair grows out. So we typically say in between 3 to 4 to 6 months, that's when you start seeing the improvement from the hair. Also, if you're complete bald, remember, you're probably not going to see any results. So, but the key with anything is waiting. It really takes that 4 to 6 months. So hang in there. Is the super capsule as effective as a topical? In my opinion, yes, I think it is. And if you combine the super capsule with the topical, you're even going to see better results. But remember, super capsule can be used only for patients for male patients or for females above the age of 50. Can I switch to the competitor with similar formula since Happy is a little bit pricey on a monthly basis? The only benefit of Happy is two things. One, we actually have more ingredients in our formula than our competitor. So I think our competitor only has minoxidil and finasteride, whereas we have minoxidil, finasteride, and retinoic acid. Also, ours is a customizable formula. I see our competitor is a one-size-fits-all. They make the same product and everybody gets the same thing. With us, we really do customize the formula. So for example, let's say if you have a sensitive scalp, we want to use it basically have you be on the minoxidil 8%, we want to have you be on the minoxidil 6% with finasteride. Let's say you're having, for example, some other issues where you just want to take the hydrocortisone out. We could take the hydrocortisone out for you, and if you want to go, let's say, on a little lower or higher concentration of finasteride, we could adjust that for you. So we really could do a lot of adjusting because we make our products every month before we ship it out to you guys. Whereas our competitor is just standalone, one product, one size fit all, but we are customizable, and I think that's probably what makes our products a little bit more expensive because we don't make a million batches at once. We're literally just making it just for you. So I still truly believe that Happy It is a better product than our competitor just because of that. Does this medicine work? I've been using minoxidil solution for a long time, but I'm not seeing any hair grow. So does it work? Yeah, I think it works in a lot of patients. Look, you have to realize that nothing's going to work for everyone. If you've been using the over-the-counter minoxidil, it is not as strong as our basically topical prescription grade minoxidil. Also, our product has combined and fortified with finasteride and retinoic acid and hydrocortisone, so it has a lot more ingredients than some of the over-the-counter medications that you see. So I think you should give our product a try. And if you don't want to do the topical, we now have the Happiest Super Capsule, which combines literally almost the same ingredients as topical all in one capsule. Is minoxidil, finasteride, vitamin D all combined together. Does caffeine restrict capillaries? I drink a strong black tea. So if so, will that inhibit success? So typically, this is a very good question. So typically, we don't say that caffeine is bad for you. It doesn't really restrict to a point where it's really inhibiting blood flow to your scalp. Should I combine oral medication with spray cream? So basically, do you want to combine the oral medication with the topical? If you do it, you will see better results. How often do I have to put the spray on my hair? It's typically done twice a day. Hey Dr. Ben, I'm just logging in right now, and I'm not sure if you asked the question, but was wondering if the new dose of topical finasteride 0.3 can still be customized to remove the aloe at all.
We don't have customizations right now for the 0.3. It would be 0.25.
Okay, so we currently, as Evelyn said, we do not have the customization for the 0.3 at the moment, but it's only for the 2.25% that you could remove the aloe. Oh yeah, so sorry about that. Here, I'm just reading the rest of your question. Since my prescriber through Happy had said that it can only be customized with the original 0.25% formula to help with, if not turning that goldish color over time, I just wanted to confirm this info. It is correct, only with the 0.25%.
It's the retinoic acid that makes it yellow.
Yeah, so it's the retinoic acid that's actually making it yellow. We could take the retinoic acid out, so you could still have the finasteride 0.25, and we could remove the retinoic acid. So email back the Happy and say that you want to take the retinoic acid out. That's what gives it that yellow tint. It
doesn't change the efficacy though.
Yeah, it really doesn't change the efficacy that much. If I take the oral super capsule, should I continue with the oral minoxidil? No, the super capsule already has oral minoxidil in it. I've done a hair transplant, and the place I've done the hair transplant, I have recommended to do PRP therapy, but I did not see any results doing PRP before. Actually, it worsened my hair condition. I think PRP is just a wasting of dollars. So that's a great question. I think we could probably talk about that at a different time. But I do a lot of PRP basically in my own personal clinic, and I think everyone does it very differently. You could definitely check out my own personal website, and it talks about how we're done it differently. But maybe one of these sessions we could have a talk about how we do PRP different than other people. But I think in general, PRP does help. It just have to be done correctly. Is there any issue with taking oral dutasteride and using topical finasteride? No, there are a lot of people that are doing that, and that's fine. As long as you don't have any side effects, it should be okay. Will the treatment work for receding hairlines? Also, will you have to modify the formula if you have a severe case of scalp psoriasis? So yes, the treatment does work for receding hairline. Number two, the product is made with alcohol based, and the minoxidil 8% and the alcohol could cause some irritation of the scalp, which could irritate and worsen your underlying psoriasis. So my recommendation is that if you currently have psoriasis, you probably request for the lower dose of minoxidil and take out the retinoic acid to avoid some of that irritation. If that doesn't help, you could also request for the aqueous-based formula, or just buy some scalp serums at night and apply the scalp serum on top of it to reduce some of that irritation. If finasteride blocks the 5-alpha testosterone conversion to DHT, why then testosterone level does not go up in your body rather than it decrease the testosterone level? So that's a great question, complicated question. The reason is because oral finasteride can still block somehow your testosterone production as well, and those are the patients basically that end up with the sexual side effects, because you're blocking your testosterone level. And there are clinical studies that show that the topical really does not change the testosterone level, whereas oral finasteride does, actually could lower it. So a lot more complicated, but we know basically that it could lower it, but not in everyone, and that's how you get the sexual side effects. Love the question, really complicated. For scalp crusting or dandruff, I use tar, basically it's kind of like the tea gel, the tar shampoo. Should I use one with salicylic acid? Yes, so there's tea gel and tea sal. The idea is that basically you could alternate the two, and you're probably going to get a better control of your dandruff. And they're both over the counter. If I've been on the oral minoxidil, oral dutasteride for a long time, and add in the topical minoxidil finasteride, should I expect a new shed? Possibly yes, because the topical finasteride could cause an initial hair shedding. It is possible, yes, not necessarily. What is super capsule? Great question, Nico. Super capsule is a combination of oral finasteride with oral minoxidil. So basically what we're doing is that we're trying to mimic the original Happy Head topical formula in an oral version. So Happy Head is topical finasteride combined with minoxidil combined with retinoic acid and hydrocortisone. The super capsule is oral minoxidil with oral finasteride and vitamin D. The whole point is to try to attack the multiple different reasons and causes of hair loss all in one capsule to kind of streamline the process. What is the ratio of your product work for black males versus white males? Oh, so good question. So actually, in my own personal office, I have a lot of patients that are both white, black, and olive skin tone, and I think the product honestly works on everyone. In my personal opinion, actually, if you're African American and you keep your hair short, actually, I think topical Happy Kid does work better than for patients that are basically white individuals with longer hair. So that's what I've seen my personal experience in my office. So I think it could work very well for basically honest individuals of all different races and all different colors, because you have to realize we all carry the same genes and we all have the same cause of hair loss. Did you say that the super capsule is for folks over 50? If you are female, it is for all males or females above the age of 50. So, but if you're male, 20, 22, 23 years old, you can still take the super capsule. Okay, all right. So if I either got the aloe or retinoic acid removed to help with the color change, it shouldn't reduce the likelihood of the results. Yes, that is correct. That is right. The aloe is only there to reduce the irritation, so it does not affect the efficacy at all. And the retinoic acid, look, it's there for slight increase of efficacy, but if you take it out, it really shouldn't change that much. I've used the 5% minoxidil for 25 years with really no results. I'm actually very impressed. I would have stopped at day 5. Well, this is good. I've recently started using your Happy product. How long might it take to see any results? Well, give us 5 to 6 months. 5 to 6 months. One more question. Maybe someone already asked this before. Can rosemary oil be used as alternative to Rogaine? Very good question. So actually, I was just looking that up, and actually, we're going to put that on our blog. So there is a study that compared rosemary oil to minoxidil 2%, and they saw that they both have the same efficacy. So rosemary oil and minoxidil 2% have the same efficacy. But here is a question. How efficacious is minoxidil 2%? So if you look at the clinical studies of minoxidil 2% compared to minoxidil 5%, minoxidil 5% was way superior than minoxidil 2%. In my personal office, I never recommend minoxidil 2% because it just does not work. In my opinion, I think it's a scam, the 2%. But, which does, by definition, makes the rosemary oil a scam too. But anyways, I'm just going to stop there. So let's see. I have used 5% minoxidil for 25%. Oh, I think we answered that, didn't we? Okay. Will super capsule have the same benefit as topical solution? Earlier you had mentioned that's advisable to use both, which is a big dent to a pocket. Can we use a capsule more convenient and expect similar results? Look, I think if you need to do one, if you need to do one, and you're a busy person, I would just do the super capsule, in my personal opinion. I think it streamlines the process, it takes 2 seconds to do, and you're getting the benefits of 3 different medications all in one. Generally, in our office, we have noticed that when patients do both a topical and oral, they see better results. But also you have to realize that, super capsule is brand new, and usually people weren't taking the oral finasteride, minoxidil, vitamin D all combined together. So the super capsule is really super up, and it's like really quite powerful relative to what we always had clinically. So why don't you just start with the super capsule and let's see how we do. Is it too I'm sorry, I'm reading Chris's question. Is it too risky to use a product? Oh, where did I go? To use that contains both finasteride and dutasteride that you guys not carry. is it too risky to use a product that contains both finasteride and dutasteride? Or are you talking about the the kitchen sink formula? Well,
Advanced formula.
the advanced formula, yes. So, is it? I mean, look. As long as you don't have any side effects from it, you could use it. Basically, it is redundant to have both finasteride and dutasteride, but there are some patients that, when using that, do see better results. So there is something going on that that we're not clinically understanding, but it does exist. We're not saying that you should use it, but the product is out there. It's mainly for patients who have failed the finasteride and dutasteride individually, so that's why they want to do that one. Even with dutasteride, the super capsule can be prescribed to women under 50. That is correct, yes. We cannot give the super capsule to females below age 50. Although we are about to come out with a female version of dutasteride that you could use below age 50. Stay tuned. I've recently learned that vitamin D can cause hair loss. Low vitamin D. I know the rationale. The reason is because you need vitamin D basically for hair growth. That's why lack of vitamin D will cause hair loss. And guys, last questions, everyone. Will taking testosterone boosters along with your product slow results? So if you're taking testosterone boosters, you're going to cause more hair loss. If you take the super capsule, that's going to inhibit some of that extra testosterone that you're adding. So hopefully it's going to balance it out. Alright guys, thank you so much for joining us. We're going to resume again next week. I think next week's going to be at 10 o'clock, a little earlier. And again, thank you for the entire team. I'm Dr. Ben Benham. Please take a moment and write us a review on Trustpilot or Facebook. We really appreciate it. If there are any other questions, please feel free to reach out to help@happyhead.com. Bye guys. Thank you so much. Bye bye.